I always remember one of my professors in medical school talking to us about the word doctor being derived from Greek, meaning teacher. And I really like helping my patients understand what's going on with themselves. I don't speak to them in medical jargon and try to make things too complicated. It's really important that they understand what's happening inside, what's going wrong, and what they can do. I try to really encourage my patients to take control of the parts of their lives that they can control. I first started quilting my first year of medical school. I was living in Anchorage, Alaska, and it was my first apartment. It was as far north as I'd ever lived, and I didn't realize that it was going to be dark for 18 hours a day. and I was studying so much, and I just needed something else to do that wasn't so much in my head. I don't remember always wanting to be a doctor. In fact, I don't really remember ever wanting to be a doctor until my senior year of college, and I did an overseas trip in Indonesia. I saw a lot of suffering amongst some of the people there, and I got a wider perspective of the world, and I realized that I should be doing more. I love internal medicine because it feels like the practice of medicine at its most essential. We are the ones that our patients really turn to in times of sickness to help make them better. Our focus is really on helping people manage disease that they have, whether that be diabetes or heart disease or lung disease. We try to focus on controlling those diseases and helping people live the best lives they can. We also tend to be the detectives of medicine, if you will. We're the ones that they send people to figure out what's wrong. We're the ones that get to kind of help figure it out and help people solve that puzzle. I grew up in a small town in Alaska. I did my training in Anchorage, in Seattle, Boise, larger cities, and I feel at home in a small town. Cities are fun to visit, but the Dalles is a place to live. And it does. It feels like home. I see my patients on the street. I see my patients at the grocery store. I warn them that I'm going to look in their carts. Yeah, I like living in a community that I feel like I'm a part of and I'm making a difference. I'm Maile Anslinger, and I'm an internal medicine physician.